My name is Deadman. I'm a registered osteopath and chartered physiotherapist, and 2 years ago I qualified as an orthopaedic injection specialist. I operate out of the Back Care Clinic in Crawley, West Sussex, where I've been operating for the last 10 years. In 2009 I went to the back show and I was looking for a machine that I could use to save my hands, and the machine I was looking at the time was over £1,000, and it was a pneumatic machine that was made in China, and there was a guy up there selling them. They were over £1,000 to buy, but this one seemed to have the same qualities at a much more reasonable price. I decided to try the machine out simply because I quite like the theory of the machine. My personal theory is that when the machine is put onto the patient's back, the organ stops on the top move from right to left at the same time as the ones below move from left to right, therefore performing a manipulation, a micro manipulation at the levels of the spinal column all the way through. Right, my theory is that the Golgi tendon organs, which are stretch receptors which reside in the tendons of the muscles, are manipulated at 60 times per second, therefore stunning the Golgi tendon organ and allowing the spasm to release, so I can get in and perform a manipulation on a patient without any pain, which I found within the very first week of having this machine. Instead of having a patient in for 2 or 3 sessions before I could actually manipulate the joint, I was finding that I was able to manipulate the joint very quickly on the first attendance of the patient, having great results. Well, the benefits to the patient are that I'm able to perform a manipulation at a much quicker time than I've ever been able to before, with less treatment time for the patient before I'm able to do the manipulation. The patient is in less pain, I get a quicker result, and I believe that I'm able to work at a deeper level on the very first treatment rather than waiting for 2 or 3 treatments before I'm able to get into that kind of level to be able to release the joint for manipulation. Well, when I showed all my other practices, I've got 4 other practitioners that work with me. When I showed them how this machine worked and the benefits as far as their hands were concerned, they were very interested to try them. So we've got them in every clinic room now. And every practitioner is now using one and wouldn't even think of not having one in their practice. From a personal perspective, I'm able to work longer hours, it's less pressure on my hands, and I no longer have any issues as far as RSI is concerned with my hands. Well, I would strongly recommend it to any practitioner, but many of my patients have bought them through the website as well, and I find that they just love them. The benefits to me on a personal perspective is that I'm not having any more issues with my hands, and I can work longer periods and make more money. Put your chin there, hold them.